Hey guys, it's Dr. Kurtz again, and we're doing our next lecture tonight on our Dinner with the Doc series. Tonight we're going to be talking about laser, which is really cool. So I'll kind of just jump right in. So laser is actually an abbreviation. Its full name is light amplification by stimulated emission rays. But that's the only time I'm going to call it that. It's going to be laser from here on out. And basically what laser is it's a machine that generates light waves that are very concentrated and at specific wavelengths. So like a very focused laser beam is what we call surgical laser. So that can actually cauterize or make incisions and those sorts of things. There's a whole bunch of different types of lasers, different classes of lasers. But tonight what we're going to talk about is the cold laser, which is at a lower frequency than say like a surgical laser. And basically what happens is the laser is those light emissions. And as it emits light, it's absorbed by cells. And so when the cells absorb that light wavelength, it stimulates them to grow, to change, and heal. And so basically what we're doing is we're using light to increase the horse's ability to heal itself. And so like I said, it kind of with laser, it seems a little bit like weird science that you just shine a light at something. But basically those light beams work on a cellular level. They change the electrical activity of cells. And so what it does is it increases the lymphatic drainage. It increases circulation in those tissues that we're applying it to. We have an increase in the amount of oxygen in those cells, and it increases the amount of nutrients absorbed by cells, especially disease cells. And then it causes an increase of microcirculation. And so if you're thinking about like whole picture kind of thing, it reduces inflammation. And then it does that by increasing microcirculation. So when we do that, especially in diseased tissue, it really accelerates the healing process. The other cool thing about laser is it actually does provide some pain relief, which it does it on a cellular level by a bunch of different things. It increases nitric oxide production, decreases the amount of bradykinin in the surrounding tissues, which can cause a soreness or pain in the tissue. And it causes the release of beta endorphins and local and systemic serotonin levels. So basically all that stuff is, hormonal changes leading to pain relief. So kind of on a more systemic level, what we use it for is to accelerate rehabilitation and healing of lameness disorders, maintain the peak performance in horses that are performance animals, and we use it also to prevent injuries from happening or reoccurring. Say your horse has a tendon injury, that tendon is always a little bit more susceptible to being re-injured. So that's where we use the laser for it. And then the other cool thing we can do with lasers, we actually can use it with some of our other treatment modalities such as PRP or stem cells, which actually increases those function, the working of those therapies. Some of the most common injuries we use it on are tendon injuries. Here, just a second. Stop it. Sorry, my dogs are playing. So tendon injuries is the most common. So those are tendon tears or tendonitis or desmitis. Another common use is in osteoarthritis. So we'll actually use a laser on a specific joint if it's having joint pain or joint disease. A really cool application is that we can use it for wound healing. That accelerates the healing speed of those wounds. And we also use it on back pain or something like a performance horse, we might use it on their hindquarters if they're having gluteal pain or something like that. And like I said, kind of briefly, we do use it as a preventative for injury. And so basically where that comes into play is, say you have a horse at a very high level or, have a lot of rigors. And you guys kind of know this, that, that can cause muscle soreness. And so kind of if you accumulate that muscle soreness, eventually that can cause injury because, then the horse starts compensating and going off and all those sorts of things. So in horses that they use laser during their training regimen, it allows them to recover faster and train more efficiently. And laser is cumulative in effect. So each treatment that we do is complementary to the last and on a cellular level. So it's on a very small level that it is complementary. but at least the systemic changes. So when we come out and do a laser, kind of what we'll first come up with is a therapy goal. And so that all depends on, how you're using laser. Are you using it for a preventative, for future disease? Are you using it as, a therapy for like a tendon injury? And really, it really depends on how long that they've had this injury that we're treating. You're going to have to do more treatments for something that's a little bit more chronic in nature. Our practice, we use a class 4 laser, and this laser, like I said, is a cold laser, so we can use it for deep tissue therapy. So that's why it works really well for some of those tissues that are a little deeper. Some of the lower class lasers, they don't necessarily reach that deep a tissue. And so what we do is we use a cold laser beam and we direct it at the area of concern, and we select the wavelength and all that stuff. And then usually treatment regimens kind of depends on the area. If it's a large area, obviously we're going to have to treat for a lot longer. But usually treatment regimens last from 3 to 20 minutes. It's really important that we wear protective eyewear during laser treatments. They can cause damage to your eyes, so that's what usually the veterinarian or the person handling the horse or something like that, they'll wear that protective eyewear. And it generates a red laser beam. There are different types of laser beams that, the color of them kind of differ on the wavelength and type of laser that we use. And like I said, we determine a wavelength depending on the area that we're trying to treat or concern. Laser is not painful. I would say we don't ever usually have to sedate them for a laser therapy. And like I said, there's usually not any side effects. Most horses like it. They kind of react to it the same way you would like massage or acupuncture or one of those treatment modalities. So that's the end of the lecture for tonight. As always, we'll post a blog post that goes into a little bit more depth about laser, and then if you guys have any questions or comments, you know how to get a hold of us. Have a good night.